group from health. I'll ask my fellow group members to just join in or add what they think is necessary. The problem of presenting last is most of the things that probably highlighted. I had her sort of preempt some of the things we're going to talk about. But in the health sector, what she said is that the strategies, the policies are there, beautifully crafted, well laid out, very nice. But the problem comes especially in health. Like in health, you cannot say that you don't have strategies in health. There are beautiful strategies in everything from malaria to HIV to tuberculosis and all that. But for example, the National Health Strategy has a very good aspect because the focus is to move from curative to preventive care. So part of the health strategy talks about involving the community at the community level, which is what you all agree is important. But then you find that as much as the strategy is there and it has that aspect of community involvement, there's no resources allocated to that. So as much as it's there, there's no political will, inadequate political will, I should say, and there are no resources to that. So how exactly do you expect these community health workers to, be part of that? And then that's one problem about the lack of will and lack of budgetary allocation. Then another thing we saw was the health research agenda. Sometimes part of the things that are in the health policies and the health strategies in this country are not really are not driven by the Ministry of Health. It's probably a certain donor or a certain body has funding towards that. And so because the ministry is sort of dependent on what the donor wants. So you find that the research agenda or the health research agenda is not driven by the needs of the Ministry of Health, but from other interests, depending on where the resources are. We talked about, it's interesting, it came up in agriculture as well, as the need for a center to sort of coordinate and help mobilize resources and funding, because the funding sometimes is there in health, but it's coming from everywhere and people are doing their own things. And like my colleague says, everyone is in their own silo doing something there and there. So I don't know if that would also bring the same problem as in agriculture, whether it would add complexities. Maybe that's something we can discuss as well. But there's definitely need for better coordination in terms of funding. Problem of corruption, money comes in for intervention, goes another way. See people buying big cars with HIV money or whatever. Which is a very bad thing. It's the truth. We made some recommendations at the national level, but my colleagues can also join or contribute to it. Still on the same point of a national body to incubate health programs. We've learned the example of the bed nets a lot about how they were not appropriate for the communities, and probably there was need for more bottoms up than a top-bottom approach. So this is also still debatable, but there's definitely need for better coordination in terms of resources, in terms of the products that come out of health research. We need, as one of the people put it, we need a more serious government goodwill, because you find the government is spending a lot of money buying, on irrelevant things like flowers or facades. For the people who are not familiar, the government of Kenya is trying to move from the heavy duty, like Mercedes-Benz and high-cost cars, to more affordable, less consumption, fewer guzzlers. So at the same time, you have a national health strategy that's supposed to incorporate these people. You expect them to work. You have not facilitated them in your budget, but you have money to buy facades and flowers and I don't know what. That is not serious. So what kind of goodwill? I mean, are we serious when we're saying that we want to have a working health strategy? There's need for basic public health. We say especially in like the rural parts of Kenya, people are becoming mothers at such a young age. You find people don't get far in terms of education. So there's need to incorporate like basic public health issues at the educational level, so that some of the basic issues that lead to poor health can be dealt with. Because if a teenage girl becomes a mother at 16 and probably she has not had a chance to learn about the importance of proper antenatal care or things like that. So that grows into a big health problem which could be dealt with if she got basic education and, basic public health education at a primary level. Then we talked about the need of working closely with health journalists and the media, especially the community radios and community media, to ensure that this strategy is not just from the top level, so that it's owned as well from the community. So it's important to develop those linkages with health journalists and make sure that they understand and communicate the strategy better to the community. My group members, do you have anything to add?
Maybe to just make a comment on point number 3, where we're talking about the need for a national center. What we had in mind here is that if you look at the National Council for Science and Technology, it's supposed to coordinate research activities in the country. But I don't think it's been able to do that effectively for failures, either policy limitations and so on. Okay, they are working. Let's give credit to you actually. They're actually trying right now. But what we were thinking is that they should go beyond that, because we already have innovative products from all different sectors. They should be able to harness that and appoint a body that will be able to incubate those ideas. Then from there, they go ahead and look for, or rather try to develop private linkages. Because I think it would be absurd to ask me as a researcher to go and identify a private institution with whom I could partner with. That is not my business, and they are likely to be shortcomings. But without that body took that role of harnessing for incubation and private public partnerships, then I think from there we'll be able to commercialize our innovative ideas. And I don't know whether I'm making sense. But we don't, the way we say that we need to develop private public partnerships, it's like we're just talking to nobody at the end of the day. Because unless a body is willing to take up those innovative ideas and to have them incubated, then we that's the thinking we had.